So glioblastoma is the most malignant, common malignant brain tumor in adults. It has a very poor prognosis, survival of only about 15 months after diagnosis. This is largely because of high cellular and molecular heterogeneity, but also challenges related to its localization in the brain. We have a blood-brain barrier that prohibits entry of compounds, but also the brain as a very nascent organ. It defines who we are, so it limits what you can do in terms of treatment. So it's been tried several targeted therapies, targeting EGFR, for example, Avastin, a drug to target vascular endothelial growth factor, and now some emerging immunotherapies with chimeric receptor antigen engineered T cells, targeting IL-13 receptor. These have garnered limited responses. So the standard treatment is treatment with temozolomide combined with ionizing radiation after surgery, of course, to debulk the tumor. And this is the gold standard. But still, about 55% of glioblastoma patients have a DNA repair enzyme, MGMT, methylguanine DNA methyltransferase, that mediates resistance to temozolomide. So it repairs the DNA damage that's caused by the chemotherapy in real time. So about 55% of these patients, they are refractory to this standard treatment. And it's because of this temozolomide chemotherapy. So we designed a clinical trial that is very hypothesis-driven. So we found in our preclinical studies that Bortezomib, which is a proteasome inhibitor, it targets a transcription factor, an important transcription factor, NF-kappa beta, that transcriptionally induces MGMT expression. So if we treat with Bortezomib for 48 hours, we could deplete the levels of this enzyme. And then if we then administer temozolomide in this therapeutic window, then we could sensitize those treatment-refractory tumors then to temozolomide. So Bortezomib is an inhibitor of a transcription factor that induces this enzyme that mediates resistance to temozolomide. So that's the rationale for the trial. It's a phase 1, phase 2 trial that's nearing completion now.